Hi, Leslie Perrin here with Piece by Piece Wellness Coaching. I'm your nurse, functional practitioner, and board certified health coach here today to bring you Piece Byte number 15. Caution, is gluten sensitivity lurking? You may have it if you have autoimmune disease or chronic symptoms. So many of us are ticking time bombs when it comes to eating gluten and have no clue. I personally found that after 50 plus years of age that I was sensitive to gluten. The general population and even traditional practitioners have many misconceptions about how diet and food sensitivity plays into autoimmune disease and symptoms. Why is that important? Well, just because you don't have gut symptoms doesn't mean you don't have celiac disease or gluten sensitivity. Celiac disease often, but not always, presents as a total gut lining atrophy due to immune sensitivity to the protein gliadin, which then leads to autoimmune antibodies to the gut lining, and gliadin is found in wheat. However, many people with CD or celiac disease are not diagnosed because they don't have those gut symptoms. Instead, they present with fatigue, bone pain, migraines, depression, weakness, or other symptoms. Non-celiac gluten sensitivity, however, is missed by current celiac testing because other possible gluten proteins that are not tested can be involved. Also, non-celiac gluten sensitivity only results in a partial atrophy of the gut lining, and many people will experience symptoms that are outside of the gut. This is because food particles that normally can't get through the gut lining because of its protection become leaky, and antibodies and food particles leak into the circulation and set up house and other organs and create autoimmune reactions and diseases in those tissues. Many people with autoimmune diseases often have gluten sensitivity as a root cause. There are true gluten allergies, but this is not as common. In fact, eating gluten, it can take 10, 20, 30 or more years for a diagnosis of disease and experience of gut or non-gut symptoms before learning that you even have a sensitivity to gluten. Unfortunately, most physicians only test people for true allergic reactions to gluten, which will not show in immune responses to non-celiac gluten sensitivity or celiac disease. In fact, many people never learn that they have gluten sensitivity, which is setting up all sorts of autoimmune or chronic issues in your body because traditional medicine does not test for gluten sensitivity. And unfortunately, once an autoimmune disease develops, individuals are even more susceptible to developing additional autoimmune diseases because of this root cause. In my case, gluten was not identified by my endocrinologist or primary physician when I developed Hashimoto's thyroiditis and arthritis. This also put me at additional risk for developing other autoimmune disease. So what can you do, and exactly how do you find out if you have gluten sensitivity? Here are some cues as when you might suspect gluten sensitivity and consider testing. Do you have any family members with a history of celiac disease or autoimmune disease? Do you have chronic symptoms such as migraines, fatigue, weakness, depression, joint pain? Do you have a diagnosis of an autoimmune disease such as, but not limited to, diabetes, multiple sclerosis, lupus, Hashimoto's thyroiditis, ankylosing spondylitis, rheumatoid arthritis? Why should you consider gluten sensitivity if you think you have any of these risk factors? It's estimated that mortality rates are higher in celiac disease and even higher in non-celiac gluten sensitivity populations, and that your risk of not following a gluten-free diet increases the risk of mortality sixfold. It's also known that Once you develop one autoimmune disease, your risks are significantly higher of developing additional ones. And this is due to the uncontrolled inflammation that results from gluten sensitivity that leads to disease. It took developing Hashimoto's thyroiditis before I actually tested and learned I was gluten sensitive. And I had been being managed for years by my endocrinologist and still having symptoms that wouldn't go away. My provider wouldn't test me for gluten sensitivity once I learned that could be an issue. And I did my own testing and learned that not only was I gluten sensitive, but the inflammation had led to other imbalances, gut bugs, nutrient deficiencies, and other things that I needed to correct. I had no idea that gluten was the root cause, probably, of my disease and my genetic predisposition. Once I learned this, I did go gluten-free, and I've been gluten-free for well over 10 years. And I expanded my knowledge by becoming a certified gluten-free practitioner. And I also studied functional diagnostic nutrition and became a practitioner. And I help others by providing access to gluten sensitivity testing and helping them reduce the risks of gluten exposure through changes in their diet and lifestyle, as well as helping them identify other potential food sensitivities, especially because many are known to cross-react with gluten. If you feel that you might have gluten sensitivity and you're interested in exploring your history, symptoms, and testing to really determine whether you may have gluten sensitivity, I'll provide a link for a free discovery call below, and you can check out my blogs on my website as well, and I'll provide the link to the website in the description of the video. So I hope this was helpful for you today, and please feel free to leave comments. Thanks for listening and have a great day.